Hi, my name is Erin, and I just want to welcome you to this online workshop. I'm from Spectrum Physical Therapy, and we're a clinic that specializes in women's health for physical therapy. And this online workshop is titled It's a pelvic health program to address urinary incontinence in pregnant and postpartum women. So throughout this workshop, we're going to discuss what urinary incontinence is, some signs and symptoms associated with that, things that contribute to causing that during pregnancy, and we're also going to discuss exercises that can improve those signs and symptoms associated with that and possibly help prevent it during pregnancy. So before we get started with this course, we'd like for you to take a moment to complete our pre-test. This is just going to test your knowledge and see what you already know about urinary incontinence related to pregnancy. Okay, so now that you've taken our pre-test, we're going to start our introduction to this course. And this is where we're going to discuss what urinary incontinence is and factors that play a role during pregnancy. So urinary incontinence, specifically stress urinary incontinence, is commonly seen during pregnancy and in postpartum women. Stress urinary incontinence is when urinary leakage occurs during activities and then maybe during laughing, coughing, sneezing, jumping, and typically that's because throughout the pregnancy, the pelvic floor muscles, there's a lot of stress on those muscles, and then your risk for urinary incontinence is increased with vaginal childbirth. So during vaginal childbirth, again, there's a lot of stress placed on those muscles, and they're just weaker, they're stretched out, and in order to keep your bladder from leaking, those muscles have to be strong and they have to stay contracted. So you get the leakage during a forceful cough or a laugh when those muscles just aren't quite strong enough to hold it. So it's a very common thing seen with pregnancy. In fact, it affects approximately 30 to 50% of pregnant women. And it also accounts for 69% of pelvic floor dysfunctions. So urinary incontinence is a problem, and research shows that there's a lack of education about what urinary incontinence is and what people can do to help it. So we're hoping through this course that you'll realize that, to ask your primary physicians about it and to seek treatment from physical therapists to help if you suffer from these, because urinary incontinence can decrease your quality of life because maybe, you can be embarrassed to go places because you're scared you're going to leak, or, you have to wear pads, so you have the cost of wearing pads and those kind of things. So knowing what urinary incontinence is the first place to start. And so now we're going to talk about the pelvic floor and how that plays a role in urinary incontinence. Okay, so this is a model of the pelvic floor. This is the spine, the lower spine, and here you have your hip bones, okay? So this would be one side of your hip, and this would be the other hip. And then what happens is these bones come down, and like these are the bones that you would feel like you're sitting on, and then they connect right here, okay? So you can see that it's kind of like, we call it like a bowl, okay? So right here, inside of this bowl is where your bladder is going to sit, your uterus, and other important organs. And so these muscles right here, they're small muscles, but they play a big role in supporting those organs, because this is like the last layer. There's no bones underneath that, so those muscles hold everything in. So with pregnancy, okay, as a woman's body changes throughout pregnancy, there's a lot of stress placed on these muscles. Okay, so they get stretched out, they become weak, they get injured, and so they're not able to support those organs like the bladder and things like that they need to. So when these muscles, if they become weakened, they're not able to constrict like they should to be able to, especially during like a forceful cough, and that's when your urinary leakage may occur because those muscles can't constrict and hold that bladder tight, especially during a cough or a sneeze or a laugh. And so what I'm going to do now is I'm going to do a demonstration to kind of help show that a little bit better. Okay, so what I have here is I have some pizza dough. And I want you to pretend, and you can try this at home too, just to kind of give you that visual and tactile feel with it. So we're going to pretend that this pizza dough is the pelvic floor, okay? So we're going to pretend, if this were my pelvic floor, okay? So if it had to support something, I could put something on top of here and it would support it, right? And if I coughed or sneezed, it could tolerate it, okay? Nothing's going to leak out of there. But as you go through your pregnancy, as you have your first child, if you have 2 children or 3 children, and your risk of urinary incontinence is increased with the more vaginal births you have. And it's also increased with, more, if the weight of the baby is greater, you're at a greater risk for developing urinary incontinence. So what happens is those muscles, they get stretched out a little bit, okay? And we're just stretching it just a little bit, okay? And over time, those muscles become weak, all right? And so now, if I were to, you see how it's already just with gravity, it's sagging a little bit. So if I were to sneeze or cough or just laugh, okay, those muscles, they become so stretched out and they're not able to constrict to hold that bladder, so urine could potentially leak out. And urinary incontinence is not the only problem associated with pelvic floor dysfunction, but it is a very common thing that's seen in pregnant women, and we hope that this introduction has been educational for you and that you have learned about what urinary incontinence is. And in the next session, we're going to discuss exercises that you can do to help strengthen these muscles and help prevent urinary incontinence. Okay, thanks for joining us.